A lot of the time, when a patient comes in for an appointment, we do something and then send them a poll to find out what they thought of their visit. Questionnaires like how likely are you to recommend a friend or family member to your doctor, or how much time did your doctor spend with you, tend to focus on what's important to the healthcare company rather than what's important to the patient. What empathy can do for you. It becomes clear how important it is to put the stakeholder at the center of every decision when you learn about ethnography and the idea of purposeful empathy in healthcare marketing. This idea is especially interesting because, after working for years in healthcare marketing in hospitals, health systems, medical devices, and life sciences, we've seen a disconnect between what marketers decide and what patients, nurses, doctors, caregivers, or even people who use medical devices actually want. As we explore these marketing strategies, it's worth mentioning our customized marketing course for the healthcare sector. This course dives deep into practical applications, using real-life cases from top healthcare companies to help you avoid costly mistakes. You can find the course link in the description below and in the first pinned comment. If you use past strategies as a guide for the future, you might end up with general, repeated content, campaign strategies, and public relations efforts, without thinking about whether these methods are still engaging key stakeholders. These ways of doing things make people lazy and don't keep up with what customers want, which is important if you want to earn their trust and, eventually, their business. Thinking about how to market again. When you think about the act first, listen later method again, some important questions come up. What if the organization's business and marketing goals could be better served by teams, partners, and strategies that were better educated and aligned around key stakeholders? What if the people who make decisions in large, complicated companies could agree on what these actions should be based on, the real wants, needs, and experiences of the people they serve? This perfect situation is talked about a lot in marketing, especially healthcare marketing, which uses a lot of study and data. However, a lot of companies only care about data points and see people as numbers on a chart. Understanding, planning, and carrying out. An all-around method starts with insights, or a deep understanding of the people we want to reach. These ideas shape strategy, which in turn shapes the core elements that power a huge number of actions and tasks. This approach leads to the creation of a full set of marketing tools, such as imagery, messaging, language use, personas, and audience targeting, all of which are based on feedback from the real experts, the audience. Strategy should ideally be based on the emotional truths and wants of all stakeholders. After that, tactics are used based on the plan. To bring it all full circle, every future investment is made with more knowledge, and its success is tracked to make sure it keeps getting better. This starts a cycle of healthcare marketers working hard every year to sell their products. When budget bucks are spent with more knowledge and accuracy, marketing methods are more consistent and work better. It brings together external partners and provides a thread that runs through the realities of different departments. It also helps marketing get the all-important support of people in charge of money. This method turns into a new way of thinking that guides your marketing, using insights to help you fully grasp people's needs, come up with strategies, and use marketing techniques that are all focused on the audience. Measuring and making sure that the actions chosen based on insights produce the desired results is how accountability is achieved. Speaking of successful strategies, in our customized marketing course for the healthcare sector, we explore how companies like these implement these techniques effectively with real-life case studies. The course link is in the description and the first pinned comment. Putting the insights-first research strategy into action. Before we can use an insights-first research approach in healthcare marketing, we need to know a lot about our audience. To do this, we need to do a lot of study using both quantitative and qualitative methods, like ethnography, to really understand what drives our patients and other stakeholders emotionally and mentally. How to do ethnographic research. To do ethnographic research, you have to watch and talk to patients or other stakeholders in their natural settings to learn about their habits, needs, and pain points. This kind of study gives us rich, detailed information that we can't get from just looking at numbers. Building empathy. To build empathy, We have to put ourselves in the patient's and partner's shoes and try to understand their feelings, needs, and experiences. This can be done by patient journey mapping, which shows the entire patient experience from the initial contact to the follow-up after treatment. Creating stakeholder personas. With the gathered information, detailed stakeholder personas can be developed to represent different groups, ensuring that messages, content, and marketing strategies are tailored to each group's needs and preferences. Creating strategies based on insights. You can make marketing plans that connect with your audience on a human level if you know more about them. To do this, we need to write messages that speak to their wants, fears, and motivations, and we need to use images and branding that speak to our target audience. Integrated marketing and communication strategies. From making content to digital ads, all marketing strategies and communications should be in line with a plan that is based on insights. This makes sure that everything the marketing team does is aimed at connecting with and reaching an audience. Measuring and making changes. Measuring is important to ensure that tactics work. We can figure out what is working and what needs to be changed by keeping an eye on key performance indicators and studying the results. We can improve our plans and tactics over time with this constant feedback loop. Success stories in insights-first marketing serve as examples of use cases. Use case 1. Changing the way hospitals work. A large hospital system facing challenges with patient engagement and satisfaction is a prime example of successful insights-first marketing. A patient journey map and ethnographic study showed that long wait times and poor communication are some of the aspects that patients dislike most about their care. With these ideas in mind, the hospital came up with a full marketing plan that was aimed at making the patient experience better. They changed the way appointments are made it easier for people to talk to each other, and started a focused marketing campaign to let patients know about these changes. Because of this, patient satisfaction numbers went up a lot, and the hospital got a lot more new patients and kept the ones it already had. The key to this success was putting patient wants and preferences first in marketing strategies and focusing on insights. Case 2. A medical goods company. A medical device business used insights-first marketing to successfully launch a new product while easing the challenges associated with significant changes in hospital procedures. By talking to and watching healthcare workers at work and doing a lot of ethnographic research, we were able to really understand the needs and problems of the end users. These insights helped shape the development of products and the marketing approach. It was possible to send targeted messages that addressed specific pain spots and used real-life testimonials to build trust and credibility. The product launch was successful, with high sales and positive feedback from healthcare professionals. The company made sure that their marketing efforts worked by adopting a data-driven approach and ensuring connection with their target audience. For those who want to take their marketing to the next level, our customized marketing course for the healthcare sector is the next step. It's filled with practical examples to help you avoid costly mistakes. Find the course link in the description and the first pinned comment.